Yes, doctor, coming to the breast cancer, how does one know that one has a dense breast? What does it mean?
So if you are asking the symptoms of breast cancer, because generally I would say today it is wiser to be just breast aware. That means that when on the shower and all that, one should be comfortable with your breast. And if you are regularly just looking in the mirror and palpating and all, any change should be brought to the doctor's notice. As far as screening recommendations are concerned, mammography, today's digital mammograms are very safe and very good. So mammography after the age of 40 years is certainly helpful, and having a checkup once a year. But in terms of screening, nothing better than being breast aware, your own breast aware, and being aware that any change in color, distortion, nipple direction, or palpable lump, that is important. Other than that, I would say all symptoms. The most common thing is obviously a lump palpable in the breast. That is the most common thing. But nipple discharge, skin changes, lymph node palpable, any new finding in that area should be taken to a doctor's notice.
So I have a question from one of my known person, and she is asking that her doctor asked her to come for a second mammogram. Does that mean that she has a breast cancer?
So I would strongly suggest that we should not live in fear and we should not go into any assumptions because the doctor wants to recheck something. In today's world, one has to be 100% sure before you take out a report and work on it. So it is good that if there's some doubt, some area to be re-evaluated, better to evaluate. But out of fear, if she is not going to the hospital to the doctor again, that probably there's something wrong, that will have a even bigger, because we can miss or delay something. So it is a participation by the doctors and the community at large to make sure that we make a proper diagnosis and then plan for the treatment.
Yes.
In this context, I want to make a point that there is a tendency that the moment cancer is diagnosed, people want to start the treatment immediately. This is one thing which I want to make people aware that there are three well-defined steps for cancer treatment. First is making a proper diagnosis, where today's time we also want to know the type of tumor. Just knowing cancer is not enough. For same cancer, for a cancer in same location, two different types will have two different approaches.
Okay.
So diagnosis itself may take anything from 3-4 days to 2 weeks or 3 weeks, but be patient. The important part from the doctor side is the hospital says to communicate clearly what is it that you are doing that is taking so much time, because people start panicking that itne din ho gaye, kya ho raha hai? Unko batana padta hai कि these are 5 things required. If we don't do these things, we will not make a good diagnosis and therefore your treatment will not be in the right direction. Second thing is a proper staging evaluation. How is a tumor, nodes, any spread anywhere else? Unless you have a thorough staging, your decision making may not be correct. So both these things are essential, and then you go to the third step of making a treatment plan, which should be done in a multimodal setting where surgical, medical, radiation, radiology, pathology, they're all integrated. So I always tell my patients that you are sitting on आप एक चौराहे पे खड़े हो, क्या रास्ता पकड़ना है ट्रीटमेंट के लिए. It is important to know where are we wanting to go and what are the ways to reach there.
Yes, doctor. So I was talking about mammogram, and is it true that even mammogram can miss 30% of cancer?
Yes. So mammography is a screening tool. It is for in this context, it's a screening tool. We do mammography for everybody who has a breast symptom. So that is an essential evaluation by imaging. So all decision makings, diagnosis making has three components again: clinical, radiological, and pathological. So mammography alone is not complete or not. Sometimes a complementary ultrasound is required and MRI is required, but mammogram is the baseline. And then there's a pathological correlation. This area has to be sampled by a needle, either an FNAC or a core biopsy or whatever, to be sure whether it's a benign or a malignant lump of what are we dealing with. So if you ask me that if it misses 30%, then how, if that is one concern a lot of people have, but how can it be so useful in that case? So if you have a symptom, then the bug doesn't stop with mammography. Even if the mammography is normal, then further evaluation by ultrasound or MRI is important. If there are no symptoms, there is no pathology, and no risk factors. If somebody is BRCA positive, BRCA positive, in that case, we even recommend a screening MRI of the breast, because then you have to be more sure. And see, mammography is a bigger challenge in younger women because the dense breast, the glandular tissue in the breast, does not provide such good opportunity for imaging. So one miss rate is higher. So if I look at this, mammography is essential or basic for screening. It is essential and basic for all evaluations of symptoms. However, if somebody has a symptom or a risk factor, things don't stop at mammography. You have to go further for evaluation.
So is there something like 3D one mammogram also?
Yes. So 3D MR is much better and superior, but 3D mammography and but there's one tomo scanning, that's also very useful. Complementary use of ultrasound with mammogram is also very rewarding. All these put together are very useful.
Okay, doctor.
And a lot of new screening tools have also come up, but they have not yet validated. Thermal scans and hand-based ultrasound investigations, all these are coming up. So one day you will find much simpler tools, because mammography women are very uncomfortable with the compression which happens for imaging.
हमसे जुड़े रहने के लिए सब्सक्राइब करें यूट्यूब पर, फॉलो करें ट्विटर और इंस्टाग्राम पर, लाइक करें फेसबुक पर, और ज़्यादा जानकारी के लिए नेशनल खबर की वेबसाइट पर जाएं। आपको टाइप करना होगा सिर्फ नेशनल खबर।